Live from the Business RadioX studio inside Renaissance Bank, the bank that specializes in understanding you. It's time for North Fulton Business Radio.
And hello again, everyone. Welcome to another edition of North Fulton Business Radio. I'm John Ray, and we are broadcasting live from the Business RadioX studio inside Renaissance Bank in beautiful Alpharetta. This office is one of about 200 offices across the South that Renaissance Bank maintains for actual live customer interaction. Imagine that. And if you are wanting that from your bank and you're not getting it, if all you're getting from your bank is 1-800 numbers and computer-generated voices and you don't have a personal connection, then my suggestion is go to Renaissance Bank and find renaissancebank.com and find one of those local offices and give them a call. And what you'll find is a real person answers the phone, or you'll get a real person's voicemail, and you'll be able to go make an appointment and go in to see them. And what you'll find, I think, and I found this myself, is that Renaissance is big enough to handle pretty much any need that you can throw at them, small enough to do it in a personal way. And that's a great combination. Renaissance Bank, understanding you, member FDIC. And now I want to welcome Steve Aleksandrowicz. Steve is with Medicare and Other Red Tape, one of my favorite names I've heard in a while here on North Fulton Business Radio. Steve, welcome.
Good morning, John, and thank you for having me here this morning.
Yeah, it's great to have you. So let's talk a little bit about how you serve folks at Medicare and Other Red Tape, and also known, let's say, at the Bonnie Dobbs Agency.
Yes, sir. That's what it is.
Yeah.
So we're Medicare health insurance brokers, and we represent multiple insurance carriers and multiple plans related to Medicare health insurance.
Okay. So let's. This may seem like an obvious question, but I've found that obvious questions sometimes have less obvious answers, and it's good to ask them. You know, what is Medicare? I mean, what explain what that whole program is for those that don't know.
Great question, John, because Medicare is a health insurance program offered by the federal government, and it was designed for people ages 65 and older, and some people under the age of 65 who are on disability for 2 years or longer. And it's designed to provide basic health benefits. And back when it was inducted in 1966, Harry S. Truman was the first beneficiary, and 19 million people joined the Medicare health insurance program, and today we have over 61 million people on the program today.
Oh, wow. Okay. So Medicare is not a program for folks with low income, right? I mean, this is a program that when you turn 65, you're automatically in the Medicare program. Is that correct?
Well, you're first eligible when you turn 65 of any income level. But I'm glad you asked that, because the cost of Medicare is affected based on your income. And if you're a higher income earner and eligible for Medicare, you could be paying above the standard rate. But there are those people who are in a low-income situation, and that's actually where the state Medicaid program could come in and help pay for some of the Medicare out-of-pocket costs and even the cost of the Medicare Part B premium if they fall into a low-income situation. Mm-hmm. So through the state, the Medicaid program, which is subsidized by the federal government, Medicare, federal program for all people ages 65 and older or under 65 disabled.
Okay, so all of us, probably one way or the other, are going to have to confront the Medicare program at some point.
Yes, sir.
Okay, well, that's there you go, folks. You're going to have to deal with it whether you like it or not, folks. We're here chatting with Steve Aleksandrowicz, and he's also known as the Medicare man. I happen to know that. He's with Medicare and Other Red Tape, the Bonnie Dobbs Agency. Steve, so let's talk about, I guess, some of the biggest fears that people have about Medicare as they're transitioning from their private insurance carrier, their health plan that they've been on at their company, they retire? What are some of those fears that they have going to Medicare? And let's talk about how you address those.
So, the fear is the unknown, because it's a whole new way to receive your health care. Most people have been accustomed to receiving their health care through an employer plan or maybe a private insurance plan, and their choices have been limited. Once they approach that time when they're going to enter Medicare system, they have no clue how it works. And what happens is they're approached by marketers. When they approach their 65th birthday, we call that T65s. Well, happy birthday, welcome to Medicare, and every marketer has your name. Your mailbox literally explodes, so it adds to the confusion. And so it's all about the unknown. Here with us at the Bonnie Dobbs Agency, Medicare Other Red Tape, we're all about education. We want to teach our clients how the Medicare program works, how all the secondary insurance options work, and what's available to them at the most affordable cost. And it answers a lot of questions, too. Can I keep my doctor? Can I afford my coverage? Do I have access to care? So these are all general concerns, and we help answer that. And what we do is we decompress that anxiety when people are approaching their entrance into Medicare. Wow.
Lots of value there. You've partially answered this question already in what you just said, but if I've got to go into the program anyway, why do I need to give you a call? How are you going to help me?
So, John, thank you. That's a great question, because we bring value to the table. We're here to educate, and we're also advocates for our clients. But there's so much confusion. We want to make sure people understand how the program's going to work for them, how those secondary insurance options are going to be to their best benefit, what the choices are. We help figure all that out. We do an analysis for our clients so we can figure out, who's their doctor, what medications are they taking, where do they live, and what can they afford, and are there any assistance programs that may be able to help them out, such as the state Medicaid program or a low-income subsidy. So this is what we bring to the table, and the best part about it is we're the extra value service. You'd want to come to us because we don't charge for our services. The insurance carriers pay us a commission if we write those people into a plan.
So I want to get back to that. But I guess what do you find with your clients? Is Medicare typically enough? I mean, you mentioned state plans, but does Medicare typically give you enough coverage?
John, no. The original Medicare A and B benefits are just giving general hospital coverage and general medical coverage, and there's out-of-pockets. There's deductibles, there's co-pays, there's co-insurance. And on the Medicare Part B services, the medical services, there's no cap. There's no max out-of-pocket. So an individual is going to be left exposed financially if they have a catastrophic situation. So secondary insurance is essential, and that's what we sell. We sell the secondary insurance programs, such as the Medicare supplements, prescription drug coverage, or the Medicare Advantage Part C option that's available to most people.
Oh, okay. So how do you walk folks through that and make a determination on exactly what mix of coverages that they need?
So great question, John, because everybody's individual situation is different. Even in the same household amongst spouses, his and her needs can be different. So we have to figure out, first off, do they want a traditional Medicare supplement and drug plan where they'll pay more out-of-pocket up front, but their expenses as they use the services are going to be less out-of-pocket under a traditional supplement plan? Or they may want to choose to save money up front and go with what I call my buddy Joe Namath's get all the free benefits you deserve Medicare Advantage. But now you're into managed care plans, and that could be an HMO, a PPO, and there's out-of-pockets as you use it. Potentially, you could spend more out-of-pocket on an Advantage plan as opposed to a conventional Medicare supplement plan, which is pre-planning expenses. So everybody's different. Their needs are different, even amongst spouses in the same household. We figure all that out.
Awesome. Folks, again, we're here chatting with Steve Aleksandrowicz. He's with Medicare and Other Red Tape, also known as the Bonnie Dobbs Agency. I love that name, Medicare and Other Red Tape, because we know it's a lot of red tape. And having you to guide us through is a great service. Let's shift gears just a minute, if we can, and talk about you. I mean, you've been at this for about 10 years now. Why did you get in this business? I mean, what attracted you to it? What keeps you going every day?
Well, it's funny you asked that, John, because in the beginning, I was reaching out to get my insurance license to sell life insurance about a decade ago. And when we go for our education to get our state licensing, we have to learn all aspects of insurance, life and health and disability and Medicare and state Medicaid. And Medicare is so complex, I practically would run away from it. But life events brought me to the opportunity to sell Medicare health insurance, and I found out there's a huge need, and there's a complexity to Medicare that it's unique. And to be an agent, to be a broker, to understand it, and to help people and to guide people through it, there's a huge satisfaction to me when I could help people. There's a fulfillment to doing that. So I really enjoy it. And, seniors, I've always had a special place in my heart for seniors. And so I feel that is a fulfilling experience to help them out and to be their advocate.
Wow. Absolutely. So let's talk a little bit about planning. When should you mention that key age of 65? So should I wait until I get to be 65? Should I give you a call ahead of time? How should someone best plan to go on Medicare?
So, excellent question, because if you wait till your 65th birthday, you're in fire mode. And we want to avoid that at all possible cost. Mm-hmm. So typically, somewhere from your 64th birthday to 64 and a half, at least 6 months before your 65th birthday, is a good time to reach out and start getting a little educated on what you're going to be approaching with your Medicare and those different options that are available to you, so that when you get closer to your 65th birthday and you're going to be signing up for Medicare and signing up for those plans, you have a game plan. And, not everything's cut and dry. Sometimes we have to figure out, are we going to go with a first option, a second option, a third option? Are you going to be retiring? Are you going to continue working? Is your employer going to offer you benefits beyond your 65th birthday? You may want to stay with those benefits until you're ready to retire, and then you're going to have to leave your employer group plan. And now you do have to go on Medicare, so you may be delaying Medicare. Awful lot of questions there, and we try to zero in on that so we can have a game plan when you're ready for your 65th birthday. You're either going to go forward with Medicare or you're going to go forward with your options that you've been with your employer until your retirement. We figure all that out.
Good stuff. Now, that addresses that individual that's working for a company, corporation with a health plan. What about self-employed folks? Let's talk to them.
So self-employed, typically they're paying a lot of out-of-pocket expense to be on health insurance. For most of those folks, they're embracing the Medicare program because they're going to finally get to a point where they can afford health insurance. And typically when you're self-employed, most of those plans are going to have a really high deductible, and that limits access to get some of the services and care that people have been waiting for. As we age, the body's breaking down, things are wearing out, people need new knees, new hips. They're waiting for surgeries that they can't afford that $5,000, $7,000, or $10,000 deductible. Now they get to Medicare, and they could be looking at a $200 deductible and go get that surgery they needed and paying a much lower monthly premium and a much lower out-of-pocket expense. So I always say for those folks, welcome to Mecca. Welcome to Medicare.
Yeah, you hit kind of close to home when you talk about things wearing out there, Steve, for sure. One question I think a lot of folks have about Medicare is, can I keep my doctor, right? Because so many folks, they love the primary care physician or other physician that they have. How do you address that?
John, that's an excellent question because that's a huge concern for my clients. When you're going to Medicare, you want to make sure your doctor's participating in the Medicare program, and most do. But what we do find is if you're looking at those Medicare Advantage plans, those Part C plans, those plans that Joe Namath proclaims get all your free benefits, now you're going to managed care plans. And now we're looking at HMOs and PPOs. And, those are typically network-based. Mm-hmm. And if your doctor isn't in the network, you may not have access to your doctor and access to the care you're seeking. Mm-hmm. So, again, this is where we help evaluate this for our clients. If they are looking at Advantage, and Advantage for many is a great option. We just want to make sure their doctors are participating in the plan, or if their doctor is not in the network, if they're in a PPO plan, that their doctor will accept it. They may have to pay a slightly higher out-of-pocket. So we make sure it works for everybody. We want to decompress that question. Can I keep my doctor? And we want to bring yes to the table.
Mm-hmm. Lots of great information here and knowledge that you bring to the table, certainly. But you mentioned your services are free. Now, how does that work? That doesn't sound like a great business model. Well, how does that work?
John, we all want to say, well, there's nothing free out there. Well, it's free to our clients. Mm-hmm. But, somebody's paying for us, and that's the insurance carriers, because if we sign up our client onto an insurance plan, the carrier is going to, in most cases, pay us a commission. Mm-hmm. And typically those commissions are regulated by the federal government, by the Centers of Medicare or Medicaid Services, so that we get paid the same for same plans by the carriers, so that we're not enticed to sell with ABC carrier versus GFW.
Right.
So we want to do what's in the best interest of our client. And, our clients, if they want to go direct to the carrier, they're going to get the same plans that are available in the open market. They're going to get the same plan, the same cost, the same benefits. If they go through us, they get that same plan, but they get the extra added value service of a local broker, somebody they can lean on when they have questions. We don't like our clients to have to be, forced to call 800 numbers all the time. There's a lot of times they have simple questions and they want to reach out to somebody they can feel comfortable with. Well, I want to be that person for my clients. I want to be the person they can go ahead and feel comfortable to call, to text, to email. That's what we're all about. We're all about the personalized service. Mm-hmm. That's us.
Yeah. Again, you kind of anticipated my next question, but lots of folks out there, I would imagine, that handle Medicare insurance. What differentiates you from those folks?
So, John, there's a lot of insurance brokers out there that are selling multiple health insurance products. They're doing, they may be doing Medicare, but they're also doing under 65 individual plans, group plans, long-term care, life insurance. That's an awful lot for one person to be fluent in. We feel at the Bonnie Dobbs Agency that Medicare is enough for us. There's a lot of complexity. And so we specialize in Medicare, and we want to bring everything Medicare to the table. And we leave all that other stuff to the other brokers. And, we have a lot of business partners out in our field that if somebody needs help with those other products, we can refer them to those folks. And a lot of those business partners, when it comes time to Medicare, they don't want anything to do with it. They just directly go, hey, talk to Steve, talk to the Medicare man. He knows it all. I don't say I know it all. I know a lot. And we're learning every day in our field of expertise because it's ever changing. So we want to make sure that we can bring the most up-to-date information, up-to-date products to the table to take care of our clients' concerns. That's what we do best.
Great words from Steve Aleksandrowicz. He's with Medicare and Other Red Tape, helps folks like us navigate the quagmire that's called Medicare. So, Steve, this has been great, and I can't imagine that having heard this interview that there aren't some folks that want to be in touch. So let's get to that. Let's tell folks what your coordinates are, how they can get in touch with you.
Well, I hope folks want to get in touch with me after this program. So, I'm a local broker. I'm here in Cumming, Georgia, here in the South Forsyth region, but I cover the entire state of Georgia. So people can reach out, call me over the phone. My local number is 404-642-5188. And that's my direct line. You're not going to get a secretary. You're not going to get an answer machine. You're going to get Steve, the Medicare man. And I'm also available. I've got a website, Steve AZ Insurance, and I affectionately called it Steve AZ because my last name is 14 letters. Starts with A and ends with Z, so why put all those letters in between? SteveAZinsurance.com, or you can email me to SteveAZinsurance@gmail.com. I'm local. I'm on Facebook, so you could find me on Facebook. I'm Steve Aleksandrowicz. You could send smoke signals.
And
we'll find each other.
I love it. Steve Aleksandrowicz, he's the Medicare man, folks, with Medicare and Other Red Tape. Steve, it's been a pleasure having you on the show.
Thank you, John. It's been a pleasure to be here this morning.
Thank you. Folks, just a quick reminder, if you've got administrative tasks in your business that are weighing you down, if you're up at night at 11 o'clock at night doing your books, I think you need a better answer for how you spend your time and how you handle your business and how you grow your business. And if you're looking for that, if you're tired of doing it the way you're doing it, give Essie Escobedo over at Office Angels a call. She's at 770-442-9246. Here's what happens when you give her a call. You explain your problem. Maybe you've got a shoebox full of receipts, or you've got administrative issues and tasks and that are weighing you down that you want to get rid of. She pairs you up with an angel who flies in, gets the job done for you, and they fly back out. And they do it on an ongoing or as needed basis, and they do it remotely. So they've been doing this for 21 years, well before the pandemic. So they understand how to handle a virtual environment. And they're terrific. And I know this personally because they work with me in my business, and I couldn't do without Essie and her team. So I think you'll be glad you got in touch. If you're shy and want to check her out on her website, go to officeangels.us. But I think it's best if you just give her a call, and you'll be glad you did. Folks, just a quick reminder that we're on all the major podcast applications. We haven't been stumped yet on one we're not on. So go check us out on Google, Apple, Stitcher, Spotify. We're on all of them. Search North Fulton Business Radio and subscribe to the show if you would. And here's my bold ask. Give us a 5-star review. This is not about me. It's not about Business Radio X. It's about our guest. Great guests like Steve. Steve AZ. I love that. And the other guests that we've had on this show, we've had over 600 guests on this show over the last 5 years, and we want them to be found so that those folks that are looking for their services can be in touch and utilize the great work that they do. So if you could do that for us, we'd appreciate it. And if you want to connect with us on social media, you can do that as well. LinkedIn, Facebook, Twitter, Instagram. We're North Fulton BRX. So for my guest, Steve Aleksandrowicz, I'm John Ray. Join us next time here on North Fulton Business Radio.